Well, these days, staying informed about world events can come at a cost. There's a lot of heavy news to wade through, whether it be threats to our country's economy and sovereignty from our southern neighbors, or the ongoing turmoil in places like Gaza and Ukraine, or the climate crisis. We're living in turbulent and uncertain times, and it can take a toll on a person's mental health. So let's talk about that. Joining me now is Dr. Katy Kamkar, a clinical psychologist in Toronto. Thank you so much for being here.
Thank you so much for having me.
So this idea of people getting swept up in the news cycle isn't new, but things are feeling especially uncertain at the moment. And I'm wondering whether it's anecdotally or from your own patients, what do you think this is all doing to people's well-being?
Yes, this is such an important conversation, especially now when, again, so many people might feel overwhelmed, right, by the state of the world, whether, again, we're talking about conflicts, economic uncertainty, climate change, social unrest, and so on. We do know through our research literature that these stressors can have a profound impact on our health, on our mental health, but there are also ways to navigate them more effectively as well. Well, first of all, in terms of going back again to your question about how any of those events and global events can impact our mental health, well, we know studies find in terms of the increased anxiety and uncertainty, right? So when we feel an ongoing sense of unpredictability, this we know uncertainty can very much fuel anxiety. So this constant exposure at times to, again, distressing events, to distressing news and so on, can make the world seem like an unsafe place at times. And so that could lead to feeling more the sense of heightened fear about the future. There is also the emotional exhaustion and burnout at times that might take place. So people might feel overwhelmed by the sheer volume of maybe crisis happening simultaneously. So that might lead to emotional exhaustion, feelings of hopelessness, and also feeling like helplessness, feeling powerless, or even apathy sometimes.
Is it possible for someone to be affected by all of this and not even really realize it themselves? Like, what are some of the red flags for people to watch out for in terms of our own feelings and behaviors?
Yes, we know that, again, any emotions that we might experience, stress or anxiety, a host of all other emotions, it's very much a mind-body connection. It has an impact on us cognitively, so our thought processes, physical reactions, our emotions, our behaviors. And sometimes we might recognize it, but sometimes it might not recognize it right away, and we might be entrenched in that cycle. Of course, the sooner we become aware of any changes in our emotions, in our physical reactions, in our actions, our behaviors, what we used to do or not do, or anything that maybe even people might tell us that they notice changes in us, then again, it's a sign that, oh, let me do something so that I can engage in healthier coping strategies. And there are a lot of healthy coping strategies that we can engage in. How can I engage in changing my perspective? It's not going from a negative thought to a positive thinking, but it's more from a negative thinking to a more realistic, balanced thinking. So because our thoughts influence our emotions, right? So if there is a belief that, oh, the world is falling apart, then it's going to lead to emotions of feeling overwhelmed, feeling maybe even powerless. So reframing our thought to, while challenges exist, I also know people are working towards solutions. And so the more balanced our perspective can be, then it's easier for us to even contain and regulate our emotions. And so very much focusing on what I have control over, rather than, again, ruminating and dwelling on the things that I do not have control over. And that can also take us to the next strategy, which is also managing the information intake. How can I set healthy boundaries? And healthy boundaries is very individualized, and it depends on our own tolerance level, to stress, noise, and people. So it could be, let's say, let me set my consumption in terms of all those debates, in terms of all those news and information, to maybe I'm fine 20 minutes every day, 2 hours every day, to now, you know what, here's a Friday and a weekend, let me just engage in those light information comedy shows to really take a take a rest. What activities help me to my everyday life? It could be volunteering, it could be donating, community discussions, social support activities with friends. It could be, again, exercise, hobbies. Very important to engage in those meaningful activities every day so that we can also help to boost our emotional resilience. And that leads us to self-compassion. How can I treat myself with kindness, with my self-care? And so instead of, again, criticizing the self, it's really acknowledging our sense of self and our emotions with kindness.
Yes, finding joy where you can. Dr. Katy Kamkar, that is some fantastic advice. Thank you so much for your time.
I really appreciate you. Thank you so much.
Well, the annual inflation rate rose slightly in the month of January from 1.8 to 1.9%, according to new data from StatsCan. It says higher energy costs were to blame for notching up